Within 3 years from the first reported cases of HIV and AIDS in 1981, the cause of this mysterious disease was identified. The incriminating acronym, GRID or Gay-Related Immunodeficiency Disease, given to the disease during the initial diagnosis soon changed, as scientists understood its nature and the different modes through which the virus was being transmitted. Once the potential scale and dangerous spread of the disease was realized, campaigns were initiated worldwide to address the immediate physical and social concerns in an effort to contain the disease. Physically new government policies were framed, humanitarian grants for poor/underdeveloped countries were disbursed, healthcare services equipped themselves with latest detection facilities, and governments pledged millions of dollars into research and ultimate cure for HIV and AIDS. Socially, with every new infection being viewed as a human tragedy, nationwide AIDS awareness campaigns were rolled out and private support groups helped patients cope with the disease. While these efforts focused on the obvious physical and social dimensions of the disease, the psychological reasons that predominantly contributed to this overwhelming crisis were ignored. People continued to indulge in risky behaviors and became vulnerable targets. Even those aware of the deadly repercussions failed to take precautions, take detection tests, or to reveal their illness, out of fear of being abandoned or ostracized. The individual psychological issues of prevention and proper utilization, on self, of available information remained at large. This, hobbled with cultural taboos and illiteracy, fueled the crisis and till date continues to do so. When people in power feel that sleeping with 10 others is not a problem, there is nothing that any agency can do. Self-knowledge of the damage done on others is vital to control HIV. Brothers and sisters moving around with relatives and friends as part of sexual experimentation while growing up is another significant dimension that needs attention. Problems relating to social abuse, public avoidance and discrimination are faced by patients, their families and caretakers even after 25 years of knowing the cause and methods for prevention of the disease. Since individual psychological issues remain unresolved, the social issues are not eliminated, and the physical implementation of policies and health services are being rendered ineffective. From the first patient, termed Patient Zero, to recent cases that draw media attention, HIV and AIDS has become a humanitarian crisis of global proportions in just over 2 decades. Whether HIV-infected patients should be allowed as tourists or immigrants are not trivial questions for policymakers, considering the large migrant workforce worldwide. Insurance coverage for the HIV-positive shall remain a hot topic. HIV has also helped to better laws towards privacy of health records. Internet usage by those with HIV or other afflictions may be tracked by companies that leave cookies without permission, thereby tracking sites visited, searches conducted, and their emails and chats, leaving to speculation what these companies might do with this knowledge.